大家好，欢迎收看纽约华人资讯网的直播现场，我是主播莉亚。那今天我们要聊的话题呢，跟每个人都息息相关，很多50岁以上的朋友呢越来越关心，但是不知道从何问起的问题，那就是我又近视又老花，我该怎么办？我还有机会不用再戴眼镜，远近都看清吗？那很多观众朋友呢可能都有类似的经历啊，就说原本我有近视啊，一到50岁呢，阅读视力又模糊了，看书要戴老花镜，看远呢还要戴近视镜，这眼镜呢一天到晚都换来换去的，甚至还有不少人要这个抬起眼睛去看手机，或者是去依赖这个双焦镜、渐进镜，还是会觉得不舒服、头晕。那么在50岁的年龄里，有没有什么办法能够同时解决近视眼和老花眼，或者是我只有老花眼，能不能够解释它？今天呢，就来讨论这一重要的话题，就是中年的视力综合矫正。那在今天的节目，荣幸的邀请到的是纽约 Raymond Fong Eye Care 诊所的创始人邝理中博士 Dr. Raymond Fong 来为我们详细的讲解。那 Dr. Raymond Fong 呢，不仅是美国顶尖的眼科医生之一，他还是拥有43年临床经验的行业领袖。他毕业于哈佛大学，并且在康奈尔医学院完成了医学学位。作为纽约地区进行最多激光飞秒白内障手术最多的医生，他的诊所呢也是美国屈光手术领域的标杆，被誉为是 Top Doctor 多年。同时呢，他还参与了多项 FDA 的临床实验，为推动眼科手术技术进步做出了卓越的贡献。首先请 Dr. Fong 跟我们打个招呼吧。Hi Dr. Fong, thank you for joining us today.
Hi, thanks for giving me the opportunity to talk to your consumers, and hopefully I can help educate them and give them some insight into some of their eye problems.
Great.
Thank you very much.
Thank you so much for joining. We have talked to you for several episodes. People know you already, but and you're a social influencer. Actually, you go viral on Red account, but still, maybe some people doesn't know you that much. So, would you please give us a brief introduction about yourself?
I was born in Hong Kong, came to this country when I was 5 years old, lived in the Lower East Side in Chinatown, where I grew up, then went to college, medical school, residency. I've been in practice for 40 years now, so I've seen a lot, done a lot, and I'm still in the Chinese community where I feel it's my home.
That's very nice. Thank you so
no,
much.
Thank you.
So, what is the presbyopia? We talked that before, but still wanted to know what is the presbyopia, why people get presbyopia, and if a patient is like 50 years old, they need glasses for reading and to, they're on the phone, they cannot see clear. What are their options?
Okay. So, I always like to use the same illustration, and the illustration I use is the eye's like a camera, and I happen to have a camera.
Nice.
Okay.
Right. It's a big camera.
Right. So it's a Nikon camera. So if you look, any camera has two lenses.
Mm-hmm.
There's an outside lens, okay, and that's like equivalent to the watch, the bubble on the watch that coats the outside,
Mm-hmm.
okay, and that's called a cornea. If you look at it inside camera, let me break my camera up. There's a lens inside as well,
Mm-hmm.
and that's the natural lens of the eye. Now, what's good about humans is that unlike a camera, which is very mechanical, the inside lens here, I have another camera, okay, is able to adjust.
Mm.
So if you think about, this is the lens that's inside the camera. As an image comes to it, it's able to expand or contract to focus the image, especially when the image is near. As you age, however, that lens that's inside cannot contract or expand anymore. It stays in one place. So therefore, the image, as you get nearer, gets more and more defocused, gets blurry. So that's 老花眼. Mm-hmm. At age 50, everyone experiences, but it actually starts earlier. Usually around 40 years old or so, people will begin to experience presbyopia, 老花眼.
So, beginning of the age of 50, I know there are different options. People may heard of LASIK. They may heard of another procedure to exchange your lens, like the inner lens you just showed us in the inside of the camera. Would you be more specific on that?
Sure. So at age 50, okay, and I'm using that as an arbitrary cutoff because some people, 45, 50, will experience a lot of presbyopia. Okay, we have wonderful technology. Okay, essentially, with this lens that's inside, okay, we can exchange it, remove that lens. It's a 5 to 10 minute surgery. Mm-hmm. Replace it with a bionic HD lens that can give you both distance and near permanently. And that's what we call refractive lens exchange or clear lens exchange or clear lensectomy. Essentially, it's trading your old lens for a brand new bionic lens that sits there and works permanently.
Great. So for this wonderful lens, what kind of condition it can treat, like presbyopia, astigmatism, people wanted to know about, or a lot of people who are over 50 years old still have nearsightedness. So
Right.
what prescription can it treat?
It actually treats everything. It treats distance, astigmatism, and near. And can have an illustration. So nearsighted people, you see a lot of my friends, for example, they wear glasses. Okay, nearsighted means you can see near. So they need these glasses for distance. But when they look up near, they have to go like this.
Right.
Or like this. They're constantly doing this. Okay. If they take off their glasses, they see near, but then they can't see distance. So what this surgery does, it takes away all the need for these glasses to go up and down with distance. Distance, astigmatism, near, it's all treated at once.
Right. And what about the patient who below 50 years old, maybe like 45 years old, still kind of like getting the presbyopia, not that much, but the lens obviously is aging and they hate reading glasses. So what about them?
Well, actually, for 40 to 45, I'm actually not even 40, 35 to 45, because now, what is our world? Our world is mostly near. It's changed in the last 20 years. Everyone's on an iPhone. Everyone's on an iPad, computer. So as opposed to distance vision 20, 30 years ago, what's more important now is reading and intermediate vision.
Right.
So for those patients, we can do LASIK. And what LASIK does, it gives you distance, but there's a little trick. We can leave one eye slightly near sight. The brain is able to adapt both of the vision in the eyes to give you both distance and near. I am an example of that. Okay, I'm 70 years old now. Okay, I had my LASIK done 28 years ago when I was 42 years old. My myopia was very high. It was like an 800. I went to Canada because in the United States, we're not allowed to do laser vision treatment that high of a myopia. I told my Canadian doctor, I said, please, I'm already getting 老花眼, presbyopia. I want to leave some nearsight. And so he did. And to this day, for most things in the bright light, I can see well, especially intermediate, about 12 inches out, which is like this. I'll give you an example. These are the notes from today.
Right.
Small print.
That's pretty small print.
Yeah. I don't need glasses. I can see up to right about here.
Wow.
Very comfortably.
Right.
Intermediate is not a problem. Near about 8 inches to 10 inches, not a problem at all. The only time I need it is if it's really, really, really close up like this. Okay, but over here in the good light, not a problem at all. So LASIK with monovision works 95, close to 100% of the time. And these are people 40 to even 50 years old. And again, what I'm doing is actually telling and instructing people who want to have LASIK done who are 35, 38 years old. You know what? If I do LASIK on you, it's best to leave some nearsight for you so that when you're 40, 42 years old, you don't have to reach for reading glasses. You may not thank me now because you say, oh, one eye is a little bit blurry than the other when I go like this. Yes, but when you use both eyes together, you don't notice it. But when you're 40, 42, you'll come back and thank me for leaving that little bit of nearsight to help you for the low five.
Right. Thank you. Wow. And you have really long arms, it really it really helps you. If you have very short arms, you have to hold like this, it would be like more easy to be affected by the 老花眼. Sorry for my Cantonese.
That's a very, very good point. That's a very good point, Leah. So one of the things that, that it's not just optics, it's also how tall you are.
Right.
So the taller you are, the further you can reach out and still see.
Right.
So I'm pretty tall, so I can do this. But again, at a comfortable distance, 12 inches, 10 inches, it's not a problem, especially in a good light.
Wow. Thank you so much. And I also know that if a patient is like between 40 to 50 years old, wanted to have LASIK monovision in your practice, actually it can be stimulate if they like the monovision or not. Because it basically based on their habits and their adaptability, right?
Right. So here's what the standard or the old standard used to be. To get used to monovision, you'd have to try contact lenses for 3 weeks. When they did that, it turns out that most of the people flunked. Why? It's not because they couldn't get used to monovision. It's because they couldn't get used to wearing contact lenses for 3 weeks, 4 weeks. Think of it. You're talking about people 40 years or so who eyes get very dry with the contact lenses. That's why they want to have LASIK. So when we actually do it on the natural eyes, the brain adapts so much more readily. So what's the worst scenario? What happens if, Dr. Fong, I can't take the imbalance? Okay, I go back in, and it's very simple because most of the LASIK is done. I just lift up that flap, a few seconds, laser, give you perfect distance vision. Then you'll need reading glasses.
Right.
So I try to caution patients. I said, please, if you really can't adapt it, just give it a few weeks. And most of them can.
Right. And also talking about the LASIK monovision and refractive lens exchange, actually they're different. Is because different group of age people may have the certain of the condition fits for which, the candidacy. And also one of the procedures is permanent, which is multifocal lens with refractive lens exchange. So would you please tell me more about why it is more permanent procedure? And people always feel like, hey, I can see clear now. Is this the clarity will remain the whole life? Or do I need a second surgery like years later?
Refractive lens exchange is permanent. Okay. Essentially, you're removing that lens. Okay, you're replacing it with bionic lens. The anatomy of the eye doesn't change after that. And that fact, that's one of the main questions patients ask me: how long will this last? So I'll give you an example. The multifocal lens technology has been around for at least 20 years. It just gets better and better, but the advances are slight because it's very, very good. My mother is 96 years old. Okay. She had a multifocal lens. She had cataracts. Okay. We put a multifocal lens in her about 12 years ago. I eat dinner with her every Tuesday in a Chinese restaurant in Chinatown. She's able to see the menu, look at distance, yell at everybody, see what everybody's eating, look back at the menu, no glasses.
Wow.
It's permanent.
Yes, definitely. Love to hear your 95-year-old mom can see
96 now.
96 now. Wow, can still see clear. That's wonderful.
Yeah.
Obviously, it will last. Like for the lens itself, you can still get the same quality of the lens in the next 30 or 40 years. And also, like, what is the recovery process like? Because my mom, she had refractive lens exchange, and I was an EVO ICL patient. I noticed there's a difference of the recovery time, probably because her age, So what should people expect? And how long can they see clear, both far, near, and intermediate without glasses after procedure?
Right. So basically, refractive lens exchange and cataract surgery. The difference is in cataract surgery, you're replacing an old lens, but the old lens has also gotten very hard. So you need more power. You need more time to do the surgery. So the recovery is slower. Refractive lens exchange, you're replacing an old lens with a new lens, but it's not a hard lens. So the power you use is much, much less. So typically in a refractive lens exchange patient, within 2-3 days, they get about 90% of the vision back. Now, the tricky part here is how nearsighted were they, how much astigmatism they had, and what the expectations are. So everyone will feel differently. Oh, within 2-3 days, I got fabulous vision. Some people say, well, my vision's okay, but can it get better? Yes. The key is be patient, give it time to adjust. Okay? But again, most people, for example, can go back to work in 2-3 days if they have a refractive lens exchange.
Got it. And I noticed so many people live in New York, they're actually nail technician. They work in nail salon. I've seen so many patients chart, like their occupation works in nail salon. So they may really need a strong reading vision. Otherwise, they just cannot do that fine job, right? So with multifocal lens works for them, can give them excellent reading vision.
Actually, a lot of my patients, majority of patients who want refractive lens exchange are nail technicians.
Right.
They're sick of using the reading glasses. And I tell them, again, it's one of expectations. We'll give you fabulous vision. It'll be for about 8 to 10 inches like this. And most of the time you can work this way. But if you want to go like this, okay, it's not going to happen. It's not that close. You might need a pair of reading glasses on top of that. But for most things, at this distance, it should be fine. So again, it's one of expectations of the nail technicians. And I do a lot of them. And most of them are very, very happy. And then when it comes to like this close, I say, look, just get a pair of reading glasses that you get from the CVS or Dwayne Reed if you need it. But again, most of the work should be like this. This should be comfortable. This is what's considered comfortable reading vision.
Got it. And also you mentioned about like multifocal lens can actually correct very high prescription like -15 or -16. However, for high myopic patients may not have such great result if they're like super high myopic, and it may work better for the middle to low myopic patients. Would you please explain that? If what other options for high myopic patients?
Well, actually, the multifocal lens they come at a very, very high prescription. So you're talking about 1,500, 1,200. You can still have a multifocal lens in. The key, though, is in these highly myopic patients, how healthy is their eye? Okay? Is the nerve healthy? If the nerve is healthy, they can have the multifocal put in. If the nerve is not healthy because of high myopia, the nerve is stretched so thin that they cannot achieve 20/20, 20/30 vision, let's say some scarring or some degeneration, then they're not a candidate for the multifocal. Okay. What we can do in those cases is, again, use blended or monovision to give them some of the reading vision. It's not as good as a multifocal lens, but it is also another option that they can opt for.
Right. Talking about the healthy of the eye, a lot of people wanted to know what is the process of getting the surgery, you know. For regular patients who want to have the refractive surgeries, actually they just need a consultation. But for people who are over 50 years old, your practice asking for a full checkup when they first visit. So what's the difference? Why they need more exams?
Well, actually, if 50 years old and over, we do free consultations for everyone. Where it becomes a issue is if they have previous surgery on that eye, if they have some nerve problems, if the eye is weak, okay, then we ask instead of a free consultation, which is free screening, they have a full checkup. But regardless, after you do a free consultation, if you're very interested in the surgery, we have to do a full checkup on you. The key is to make sure that the nerve is healthy, that the optic nerve can see 20/20, 20/30. And of course, I check everything else. But we want to make sure that those patients that we operate on have healthy eyes and that they will be happy with the result.
Got it. Thank you. And also, occasionally people will ask about the different brand of the multifocal lens because Chinese patients, they always research too much that sometimes you feel like, oh, you know too much. So to me about the brands, like what's the brand's differences, like Johnson & Johnson, Alcon lens,
right.
Which one you use?
You know, it's funny. I just had a patient today who asked me about the different brands.
Right.
She didn't know the name of the company. She goes, somebody told me V is not good. I said, that's Vivity. I don't use that. I use Panoptic. He goes, what about JJ? I don't use that. Oh, she says, good. Here's the thing, okay? I say to the patient, you're not the doctor, okay? Are you going to go to your internist and say, I want this diabetic medication? No, you want to go to a doctor who is able to use all the different lenses, but also have the experience to know which he or she feels is the best lens. Trust the doctor to advise you to use that lens. Don't tell the doctor, I want this diabetes medication. I want this high blood pressure medication. The doctor is the best one to decide. So for me, I stick to certain brands that I'm very, very comfortable with. And, you know, every year there are newer lenses coming out. Okay? It's a matter of scouring the literature, finding out from my colleagues which ones they like, and then using them myself to make sure that the patients are happy.
Right. So usually you don't use like V lens, you don't like JJ lens, but you use Alcon lens. I mean, there's a rumor outside. The reason why people don't like it is because the vision results, some people just get a poor vision results. That's the reason why people just heard from it and they thought they know everything and they're asking for it. Yeah.
Okay. So actually, to get very technical, there's two types of multifocal. There's actually a true multifocal, trifocal. Gives you distance, intermediate, and near. So I like to use the Alcon Panoptic. Okay, and that gives you a true trifocal, distance, intermediate, near. Now Alcon, the same company, makes a V lens, Vivity. It's actually distance, intermediate, some near. Okay, it's called an EDOF lens, extended depth of focus lens. The Johnson & Johnson lens is an EDOF lens, extended depth of focus lens. Distance, intermediate, some near. That's just a technical. Now, some doctors love the J&J. I happen not to like it. But again, it's one of doctors' choice. I will tell you, worldwide, Alcon is the biggest eye care company. Their lenses are the most expensive, and yet they are the most popular, the best-selling in the United States.
Got it. And also, people may wonder, like, how much does the surgery cost? Because sometimes people just don't know how much does it cost. They thought it may cost just $1,000 per eye, but actually, so much technology in that. They're just way low for eye surgery. So, what would you explain for that?
Okay. First of all, these multifocal lenses are expensive. Each one of them costs over $1,000. And there are ways to shortcut it, make it cheaper. For example, some doctors will do the surgery in the office. I prefer not to do that. I want to do it in a licensed surgical center where everything's clean, everything's sterile. I know the equipment is top notch. So our cost for both eyes is about $9,000. That includes everything, the surgery, my surgeon's fee, follow-up, any touch-up that I needed. If you think about it, this is your vision for life. It's $4,500 per eye. It's a pretty good bargain. I've actually had patients come in and say, Dr. Fong, I'll do it right now if you only charge me $1,000. What can I say?
Right. I mean, maybe find somebody else, but I bet they cannot find a doctor in the U.S. who charge $1,000 for a multifocal lens. I mean, just not reasonable.
In the trans community, and I've been here for 40 years, I love it because the things I hear, the things that I see are just incredible.
Wow. I mean, the community needs to be educated, and thank you so much for all these interviews and also your red post. Actually, just do more education to patients. Now you're getting more and more attention from that, and people learn from that. Maybe in the next year or the year after, you won't hear any stupid questions. It's because they're fully educated.
No questions are stupid.
Right.
And believe me, there would be more and more questions. And I appreciate it. I love talking to my audience. It's great.
And also, your practice offer 24-month interest-free, which means $9,000 per, both eyes for multifocal lens can break down to $14 per day. That sounds much better. I mean, $14 per day, just 2 cups of the coffee, right? So, asking for your consultant to help them to set up the payment plan. And thank you so much for being joining us today. 那么，如果大家感兴趣的话呢，实际上都可以扫描屏幕上方的二维码来，请老博老师放出来一下。邝理中博士呢是纽约这个眼科手术可以说是做的最多的医生。那莉亚呢采访过很多眼科医生啊，那有一些医生呢，听说这个纽约的邝理中医生就说，哦 ，Dr. Fong, he has been in the industry for his whole life。就这个是他多么资深的这样的一个证明。那么同时的话，大家如果对 ROE 手术感兴趣的话，可以扫描屏幕上端二维码，9000块钱2只眼睛。因为邝理中医生呢是希望大家知道价格再去诊所的，不是说像有些诊所那样说把价格隐藏起来啊。那这个呢就是一个公开价码，9000块钱2只眼睛，跟你的这个度数没有关系。如果需要24个月的零利率分期付款的话，可以 break down to 14块钱一天啊，所以呢就是听起来会好很多。那么这个手术做完了之后呢，不需要近视镜，不需要老花镜，不需要散光镜，而且呢是此生的都不再患有白内障，所以它是一个 permanent， 这是个永久性的手术。除此之外的话，50岁以下您当然也有 LASIK 的选择，而且呢如果您没有老花眼，只是近视问题的话，那么我们还提供最先进的激光技术以及 EVO 爱笑晶体植入。此前的这个视频讲解当中也都讲解过了，那大家点击现在视频上方拼注的这个视频的话，可以来看往期节目了解更多。Thank you so much, Dr. Fong, for joining us today. It's really happy to talk to you. Right. Looking for the next episode. Thank you.
Okay.
Great.
Take care and say goodbye to the whole audience. Bye-bye.
Thank you. Bye-bye.